Hello, hello. Welcome to another lesson. Here we are now going to look at healthy living or positive living. Okay, that is in HIV and AIDS. This is another topic we are trying to cover in psychosocial counseling because it's important that you have information about healthy living or positive living. Health living means, among other factors, the client's ability to do partner notification, his or her ability to accept and adjust according to the new status, and the ability to take personal responsibility, to take care for self, partner, and the family. It also implies the initiative to take affirmative action to prevent the further spread or that is the spread of HIV or reinfection with the HIV. Okay, so a lot of people might have been tested and then they decide to hide their status to their partner. This brings about reinfection. So in healthy living or positive living, all partners need to know their status so that collectively they can put in measures to sustain their life, prevent opportunistic infection, and also take measures of dealing with any infections that may come within the status that they have. People living with HIV and AIDS must avoid practices that aggravate HIV/AIDS, such as excessive beer drinking. Okay, so please, beer drinking is a social thing, okay, where a lot of people socialize. So the discouraging of excessive beer drinking is that they will start forgetting to take their drugs, and beer does not have all the nutrients that they need for their own positive living. So if a person takes beer, please, you have to encourage them to take in moderation, because this is important for moderate, that is for positive living. Okay, so for those that smoke, if they smoke excessively, smoking predisposes to cancer. So if it can be done in moderation, and if possibly they can stop, then that can be stressed. Okay, so in positive living, we also try to talk about indulging in multiple sexual relationship. We talk about this because if one is engaged in multiple sexual relationship, this reduces their immunity, and there will be a lot of viral strain that they are going to be infected with, making it difficult for the antiretroviral drugs to work, because reinfection might have happened at a lot of times. Okay, it might have happened at different levels, making it difficult for treatments to necessarily work well for them. Also, unplanned for pregnancy can be avoided through use of condoms and family planning. Okay, but some key strategies in health living includes acceptance, diet, exercise, cleanliness, personal hygiene, and early treatment of opportunistic infection. So when we say some of the key strategies in health living, when you say acceptance, most feasible strategy for health living is for the client to accept his HIV status, adopt relevant coping strategies, and make personal judgments. Ongoing supportive counseling will help clients achieve acceptance. Okay, so positive living, we are saying the clients need to accept their status and adopt relevant coping strategies. Then on a diet, as a strategy for healthy living, good nutrition habits and eating a balanced diet high in protein, calories, and vitamins will keep the immune system strong. Using vitamins and nutritional supplements is also recommended. Daily intake of prescribed multivitamin tablets also can be something that you can advise clients to do in trying to boost the immunity. The client should be encouraged to eat locally available foods that are easily accessible and affordable. Okay, so caterpillars, they are very good, and also if there are certain insects that people eat, sorry to call them insects, but there are these insects which they call inswa. Okay, so those are very good. They have high grade protein, and from those you are less likely going to get something which is genetically modified. Caterpillars, they have got high grade proteins. Okay, also grasshoppers, for those that eat grasshoppers like in shonkonono, you get it, those have nice content of whole protein package. But otherwise, when we talk about red meat, okay, it may have certain chemicals or potent chemicals and hormones that may affect the immune system. So red meat should be eaten in moderation. White meat, yeah, it can be eaten. White meat, that is fish, no chicken and the likes, this can be eaten as it is easily digested by the body. Okay, all in all, please, you should just eat that which is easily accessible within your area, and it should be a balanced diet. There are a lot of supplements out there that advertise, okay, provided they do not say it's a cure unless scientifically proven. Please, you can all take those supplements. Otherwise, you also need to take care of your kidneys, because taking supplements unregulated may predispose you to kidney problems or liver problems. So that's why it's important that you seek advice from healthcare expert. Okay, so the other strategy for healthy living is exercise. Regular exercise strengthens the immune system and reduces stress within the body. Okay, also it helps reduce the boredom. It may also improve the health status and the stamina of the client. So it is important, whether HIV positive or HIV negative, please, we need to exercise. Okay, for our own immune system, for our own improved mental faculties, we need to exercise. Okay, so on cleanliness as a strategy for healthy living, this is important in the prevention of many communicable diseases that may include TB, okay, that is tuberculosis, sexually transmitted infections, and the HIV. A person's home should be at all times be very clean, especially the kitchen, bathroom, and the bedroom. Food should be cooked well. Food should be cooked well and stored properly. Okay, and also drinking water should be boiled and stored properly, so that one does not necessarily suffer from diseases that they can easily avoid. Then on the other strategy for positive living is, apart from cleanliness, is that of personal hygiene. This involves washing the body and clothes regularly, using clean bathings, and washing hands regularly, especially after use of the toilet. Good personal hygiene helps reduce the chance of cross-infection, especially in immunocompromised patients. Okay, so the other strategy in health living is early treatment of opportunistic infection. Early seeking of medical care when one is sick is recommended, because it helps the physician and clinician diagnose the disease and other treatment in good time before complications occur. Okay, so these are some of the strategies that can be used for healthy living. Okay, so we can also now discuss about home-based care, HBC, which is very, very common for some people that have been sick from HIV, that may need home-based care and not necessarily hospital stay. Okay, so when you talk about home-based care, it's a strategy that is used in the management of people living with HIV and AIDS within their home environment. Okay, there are organizations and communities that are involved in helping people with chronic illnesses, especially those with AIDS. Home-based care is a very useful strategy in AIDS care, and it is promoted primarily with a view to decongest the inadequate health facility, as well as a means of involving families in the care of the chronically ill. Community volunteers and family members usually provide the services, but with constant support by the professional healthcare providers, this service can be well improved. Okay, it can be well improved and well received. Okay, so community volunteers and family members are going to do this, but they should be supported by professional healthcare providers. So when professional health providers are doing home-based activities, they are trying to provide palliative care, okay, and also they are trying to prevent, or they are trying to take care of opportunistic infection that would make the client be hospitalized for a long time. Okay, so what are some of the activities that happen during home-based care? So there is palliative care. There can be home visit from professional health care or nurses. Okay, the nurses, there are some nurse assistants that can be employed to offer continuous nursing care, or there can be professional nurses that can be employed to do nursing care. These home-based care centers can also have counselors, okay, to provide ongoing counseling. Okay, nutritionists may be involved in home-based care, so because nutrition helps to improve immunity and can help the patient to recover fast. If there is need for reproductive health care for those that are pregnant in their chronic state, reproductive health care can be given. And psychologically also, we need spiritual support and also social support for these patients that needs home-based care. Home-based care coupled with healthy living and antiretroviral therapy can greatly enhance the quality of life for those in need, because for one, being admitted for a long time in the hospital becomes uncomfortable, so they would want to be at home, and then those services that would be needed necessarily be done at home. So the counselor's role is effectively facilitate constructive dialogue and communication on these issues, and to promote family and community involvement in supportive care for persons that are living with the HIV and AIDS. So we cannot avoid talking about home-based care when you're talking about counseling, because as counselors, these are areas in which people can appreciate our services. Okay, so and after talking about home-based care, we can now also look at antiretroviral therapy, okay, which is the treatment that is given in HIV treatment. So this antiretroviral therapy is a strategy whereby clients are given antiretroviral drugs to reduce the morbidity and mortality as a result of HIV. The ART strategy greatly enhances the reduction of suffering of people living with HIV and AIDS, and improvement in their own quality of life and that of their own families. The counselor must stress that antiretroviral drugs do not prevent or cure HIV/AIDS, but they only improve quality of life. Okay, so when I say do not prevent, necessarily here, there are some prophylactic treatment for people to do with HIV. But for when one is already infected, they will not prevent reinfection. Okay, so then on the cure, people need to know that when someone is taking antiretroviral treatment, the virus can be suppressed to undetectable levels, as to some people thinking now they have been cured. So people that are infected and are on HAART, okay, on high reactive antiretroviral therapy, needs to know this. Otherwise, we are going to have a lot of people that will think that they are cured and yet they are not. So the counselor must also talk about the goals of antiretroviral treatments, which are 1. Reduction, 2. Restoration, 3. Improvement, 4. Reduction of OIs, and 5. Possible reduction in transmission. So when we say 1 reduction here, okay, so it's a reduction of viral load as much possible for as long as possible. Okay, so we have to reduce the viral load. So in the first goal, we want to reduce the viral load. Okay, then in the second goal, we want to restore the immune function. When we reduce the viral load, we also need to restore the immune function so that the HIV is kept in check. Okay, then we can now improve the quality of life. So the third goal is that of improvement of quality of life. Then the fourth goal is the reduction of HIV-related illnesses like TB, okay, and also reduction of HIV-related mortality or death. Then the other goal is that of possible reduction in transmission of HIV. So it's important that as a counselor, you know the goals of ART. So as a counselor, you must put it clear that when the client is eligible for ARTs, a combination of drugs from different ARV classes will be prescribed and should be taken every day as prescribed by the health personnel. In Zambia, a person is eligible when CD4 is at a certain level, but the policy necessarily has changed to when someone is tested positive, they have to start treatment right there and then. Okay, so in absence of CD4 count, when a person whose stage is 3 or stage 3 or 4, they were started on antiretroviral treatment. But this time I'm saying it's when tested positive, then you can be commenced on treatment, and we are no longer using the CD4 guide of 350 and less. Okay, so otherwise, for who stage 3 and stage 3 and 5, in absence of CD4, we were starting the treatment, okay, for HIV. Okay, so someone will be started on heart, which is highly active in viral therapy, and the heart consists of combination of at least 3 drugs. Okay, so the 3 drug combinations that are found in antiretroviral drugs are nucleoside reverse transcriptase inhibitor. Okay, apart from nucleoside reverse transcriptase inhibitor, we have non-nucleoside reverse transcriptase inhibitor. Okay, so then and then we have protease inhibitors. Okay, so common drug side effects of people taking antiretroviral drugs should also be discussed depending on the drug regimen that the patient has been put on. So for any updated regimen of antiretroviral drugs, you can always refer to the standard guideline for HIV treatment from the Ministry of Health website. Some side effects include the following. Okay, there is bone marrow suppression, and this is mainly seen in zidovudine, which has been phased out, Okay, so zidovudine has been phased out in most clinics, and by this time, I think when I'm doing this recording, zidovudine is not being used. But otherwise, it was a culprit that was bringing about bone marrow suppression, hence a patient having anemia or pancytopenia. Then there can be peripheral neuropathy. This will come because of zidovudine or didanosine, which are non-nucleoside reverse transcriptase inhibitor. Then the other side effects that are seen is liver toxicity causing excessive jaundice, and the culprit here is nevirapine, and occasionally efavirenz may cause liver toxicity causing excessive jaundice. Rash is seen in efavirenz and nevirapine. Diarrhea can be seen in didanosine, Keratra, and tenofovir. Then it has also been reported that the side effect of reduced sexual libido is seen in emtricitabine. Okay, so reduced sexual libido is seen in emtricitabine. Insomnia and hallucination are quite common in efavirenz, and people with history with mental illness are not necessarily supposed to take efavirenz because it may activate the mental illness. Okay, and the person may have some mental illness attack. Okay, so it is important that as a counselor you familiarize yourself with these side effects so that you can explain that to the clients so that they understand and they know how to avoid these side effects through positive living behavior adoption. The counselor must also address the issues of drug adherence, that is, taking the right drug daily at the right time with the right dose, the correct number of pills, and with the correct nutritional consideration. It is also advisable for the clients to have a treatment supporter to be reminding the client when the time to take medication is due, and to observe and report any adverse effects of the drugs. Alternatively, the client can use electronic devices such as a clock alarm or phone alarm to remind them of the time to take the medication. Okay, so others can even develop what we call a pill charts or pill boxes and medication diaries that can also be used in the adherence monitoring services. Issues of inflammatory constitution syndrome must also be highlighted, okay, which is a condition the condition is exaggerated inflammatory reaction that occurs when a person is commenced on antiretroviral therapy, where the client becomes more sick for some time as the immunity stabilizes, especially in TB or HIV co-infection. Clients can be necessarily advised to see an expert so that other immune boosting activities or strategies are commenced. It is also important to discuss with the client about the drug interactions when they are also taking other prescribed medication. For instance, some ARVs, nevirapine, efavirenz, and ritonavir, these may decrease the effectiveness of oral contraceptives. Okay, so when one is taking this, and we also want to prevent mother-to-child transmission and the like, a woman might be taking oral contraceptive pills, but its effectiveness will be reduced when they are taking nevirapine, efavirenz, and ritonavir. Okay, so for pills that might need decreasing the amount that might need to be taken, the client should also appreciate that they may also bring other side effects within the body. So proper nutrition is needed, and avoidance of other toxic material that may affect drugs should also be avoided. Okay, sorry, I might say negatively something to do with herbs, okay? But otherwise, taking, highly concocted herbs may worsen the condition, as it will increase the load on the liver. Okay, so remember, antiretroviral therapy like nevirapine, efavirenz, and ritonavir decrease amount of estrogen and progesterone that is contained within oral contraceptive pills. So when you're also taking concocted herbs, they might decrease the function of the liver or the kidney, hence predisposing you to predisposing you to other conditions of the liver or kidney. Rifampicin, a TB drug, can also interact with the nevirapine. Female clients on heart are also advised to seek medical advice if they intend to get pregnant, so that drugs that might be teratogenic to the unborn baby can be substituted. Okay, so we have been looking at antiretroviral therapy. So there are different types of antiretroviral therapy that are used in Zambia, and we might have other latest classification that are being used in Zambia. But otherwise, we have protease inhibitors, we have non-reverse transcriptase inhibitors, we have but from that, from non-nucleoside reverse transcriptase, we have protease inhibitors. Okay, we also have integrase inhibitors. Okay, so depending on the type of drugs that you have bought, we also have fusion inhibitors. Okay, so some of these drugs might be very expensive, but you find that in Zambia, currently, by the time I was recording this, we have 4 classes of antiretroviral drugs. That is the non-nucleoside reverse transcriptase, okay, nucleoside reverse transcriptase, integrase inhibitors, and the protease inhibitors. So those are the 3 classes of drugs that are available in Zambia. Okay, so when one is on an antiretroviral drugs, they will take a combination of 3 drugs from different classes that I've just mentioned. And then we need also to familiarize ourselves as psychosocial counselors to some of the side effects that may come because one is on antiretroviral drugs: bone marrow suppression, peripheral neuropathy, liver toxicity, rash, diarrhea, reduced sexual libido, and insomnia or hallucination. So we need to know the drugs that may bring about these side effects so that we can give the necessary counseling that the patient needs. Okay, so when one starts taking antiretroviral drugs, when they have just been diagnosed with the virus, they have an inflammatory reaction syndrome. Okay, they start becoming sick. This is because there's reconstitution of the immune system. Okay, so the clients needs to be counseled that this is happening because of immunity stabilization. Okay, and for those that might be on other drugs like oral contraceptives, they need to know that some antiretroviral drugs may reduce the effect of the drugs that they are taking, which is oral contraceptive drugs. And then for those that are on TB drugs, rifampicin interacts with the nevirapine. Okay, so necessary expert advice is needed also for those that want to conceive. Okay, so today we are looking at positive living. So we talked about positive living, positive living strategy of acceptance, diet, exercise, cleanliness, personal hygiene, early treatment of opportunistic infection. Then we went on to talk about home-based care, which is a type of care that is given to the terminally ill. And this care is especially important for people, the people who are suffering from the end stage of HIV. So instead of them being admitted for a long time, the services can be offered at home. Okay, so that they can feel more free at their own place. So there are activities that can happen still within the home-based care, and that would be ongoing counseling, nutrition care, spiritual support, and nursing care. So from me, I'm saying keep on studying and don't forget to listen to all our psychosocial counseling lessons.